28th
28th of November.
of November. He had been in the hospital since July the 12th. And since then, we have been jumping through hoops because the hospital had one insurance company. We went through that, found out that all of the building that they were sending to the other provider, they were rejecting because we were under Louisiana Healthcare Connection. So it's just one big problem, and I think that it needs to be relooked at because there's more problems than what anybody really realized or understand.
When you started encountering these problems with the Bayou Health program, was anybody explaining anything to you? Who do we talk to? Were you talking to people at DHH? Were you talking to Bayou Health? I mean, who were you having to talk with?
I've talked to everybody I could. I started with the state representative. I've talked to Bayou Health. I've talked to their nurses. I've talked to the emergency room personnel who's having a lot of problem with it as well. I've talked to DHH. I've talked to just everybody I possibly could talk to about the problems that I was having. Then after looking at Bayou Health online and looking at the 5 different providers that we have and trying to figure out where do we fit in with all of this, and then making a decision as to, okay, I need to change. And it'll take you about 30 days to change.
But that was all on you.
It was on me. I did it all.
Right.
I mean, it wasn't anybody that I could call to help.
DHH wasn't helping you.
DHH wasn't helping.
They were telling you what the situation. Go. Here's what you have to do. Go do it. Huh?
They were telling me they were sorry. That's what they said. Well, I'm so sorry. I wish we could help you. You figure it out for yourself. And that's what I had to do. I had to basically figure out for myself, how do I go about getting this thing done so that my brother could be released from the hospital? Because without the medication, without the supplies, without home health, he could not be released from the hospital. And with all of this and all of the waiting and everything that went on, my brother now is very badly constricted because his arms and his legs are not, moving like they should because he was in the hospital. He was just in the hospital, and there was no physical therapy. There was nothing going on for him. So really, his health has declined even more because we're waiting around trying to figure out what do we do with him. You put him in a nursing home 50 miles away, or you put him in a nursing home 3 or 4 hours away, or you bring him home. So these are the things that you have to kind of figure out while you're going through this whole process. And no one is helping you. There's no one there set up. There's nothing there set up to where you can go and talk to someone and they can help you make a sound decision about any of this. So, you're stuck. And the sad part about it is, if you place him in a nursing home, the only nursing home is 50 miles away. There's a hardship. How do you go care for your loved one 50 miles away? How do you go from Alexandria, Louisiana to New Orleans to take care of your loved one? I mean, it's just too hard to have to do to manage his care. In addition to that, the state will pay between $4,000 and $5,000 a month for him in a nursing facility, and the family who wants to take care of their loved one, you don't get paid for it, because I don't get paid for anything that I do for my brother. I do it because that is my brother and that is my responsibility. But I don't get paid for any of this.